wondered how technology is transforming the way we recover, train, and perform? Today, we're diving into the future of physical therapy and sports science with Dane DeLozier, co founder of Revo. Dane's at the forefront of blending rehab, gym services, and cutting edge tech to help people move better and stay stronger. Stick around as we explore how data, wearables, and a holistic approach are performing or transforming the game for athletes and anyone seeking to elevate their health. Today, we are sitting down with Dane DeLozier, co founder of Revo Physiotherapy and Sports Performance. Welcome.
Thank you. Happy to be here.
Excellent. All right. So you've built Revo with three distinct arms: physical therapy, gym services, and sports science. How did this integrated model evolve, and how does it create more seamless experience for your clients?
Yeah, great question. This started, 10 or 15 years ago. Brian and I, my business partner, kind of wanting to do more than what we were basically allowed to in an insurance-based model. And we found that, kind of that gray area people often find between I'm kind of done with physical therapy, but I'm not quite where I want to be yet. So maybe moving into a strength and conditioning program, we wanted to be able to provide that whole service to a client, day one post-op ACL all the way to returning to ski. And along the way, we found this technology mostly via research. A lot of the research we were reading was kind of proving out some of these principles with motion capture and force plates. And we thought, well, why would we not integrate that in how we practice? And it initially started with using an iPad to do that kind of thing. And we kind of graduated up to these more advanced services. But really, it's about providing just the better service for the client so we can figure out the root cause of their pain or their dysfunction a little bit faster. And then, even show via the biofeedback with these tools, how are they getting better? Is what we're doing working? Troubleshooting within sessions. So that's kind of where we got started with that.
Okay. So, I mean, you've invested quite a bit of money, I imagine, into this technology and this reserve for, imagine, like research institutions. So, what would you say also like maybe motivated you to bring more of that motion capture force? You said the force plates, and maybe you can even explain a little bit more of that, the EMG, into sort of a clinical setting when most practices probably don't even do this.
Yeah. So I'll use the example of an ACL patient. That's kind of where we really found how beneficial this is. We're going to use the motion capture. Think a patient squatting, doing a step down, even just walking, and we'll have little LED markers on that person, and then the system will overlay joint angles on top of that. So over time, we've developed kind of our own algorithm looking at what do these angles mean? What might be at risk? Where are we in the rehab process? And then as we started adding these other services in, it got even more robust. So think the EMG looks like a little key fob for your car. We're going to stick that on your skin on whatever muscle we want to assess. And it's basically measuring the electrical signals that are going through those muscles. So as we can now we're seeing what's on the screen for their movement quality, and we think, okay, knee might be at risk here. Well, why is this happening? The EMG can give us a little bit more information on muscle activation and sequencing of, the big muscle groups that we want to be evaluating. So either, proving or disproving our ideas in that way. And then we're doing something similar with the force plate. So it's basically this big plate in the ground. It's measuring shear forces in XYZ planes. And what we do is we combine all of those forces into the resultant. So nerdy physics talk, it's the ground reaction force. And where that ground reaction force is in relation to your hip or your knee or your ankle can tell us a ton about how you're moving, what are you going to do when you're fatigued, where are you in the whole rehab process. And integrating all of those together, although it's been a challenge, we found that it gets better results for the patients for sure. It makes evaluating easier for our providers, so we can be really quick within session to kind of decide when are we ready to treat, where are we in the process. But again, the main benefit is it's a better service for our clients, and we can make return to sport decision making in a much better way versus just guessing. We have a data set that we're going to rely on to help us make that decision.
Okay. So you mentioned, I mean, obviously you have more services and things going on. So like for many wellness businesses struggle with deciding which services to offer in-house versus referring out. And so now you've integrated this technology, but how do you determine which specialties to bring under your roof? Like maybe the chiropractic or nutrition or massage therapy.
Yeah, yeah, that's a great question. Yeah, the number one thing we're asking ourselves is this going to be a benefit to our clients? Early days when it was, just uh, mostly PT and strength care, are we referring out for massage a lot? Okay, yes. So our clients are finding that beneficial. Of course, we're all in on the benefits of that for the client, but beyond, is it a net positive then? Can we find a provider that works well with us and is into collaborating? Sometimes there's great providers, they're doing their own thing. But if we can find someone that's, really integrating well with our system, and then they also find benefit, collaborating, being able to talk, in the hallway versus I'm emailing someone and I have to refer the patients out. Like that's the easiest partnership to make. And we have lots of folks now on the team that fall into that category where it's such a great service. It's a no brainer. And then the provider themselves is just working well within the system, and the communication makes it such an elevated service for the patient. Like that's how we think about it. And bringing on again, nutrition or massage, those are just so great for our clients.
How do you go about identifying and developing the talent that can work across all these different areas? I mean, and obviously too, it's like communication super important, and just but how do you go about it?
Yeah. So, something we do often, we actually just had one last week. We'll do lunch and learns where we either have a staff member kind of presenting on, a passion project, an area of interest that they're really into. We bring in other providers from the community to kind of, present what they but then also, when we get people started, it's tons of repetition, working with the technology, observing a provider that's maybe been doing it for a lot longer, almost like a mentorship process in that way. But it does take time, especially, we'll use PT as an example. If you're coming from the more traditional insurance-based setting, there's lots of things we do here that we couldn't do. You would have no repetition or frame for that. So working with a clinician that's been doing that for a long time, it's basically just a long mentorship process, has worked well, but it is a challenge, figuring that out, and different providers learning styles for sure.
Okay, yeah. And then you had even mentioned about using like PT student rotations as sort of an extended interview. What are maybe some qualities that you try to look for that just to help them to thrive in your environment? And obviously you want them to do well, and but you want them to be able to be open and adapt. So could you share
Yeah.
some of that?
Yeah, absolutely. Sure. So the number one thing we look for is growth mindset. The PT students that really embody that do so well. And PT school, you're learning what's inside the box. There's tons of stuff coming at you all the time. And then to just get thrown into a scenario like this where you might be asked to strength train a client, to work post-op, to get someone back sport specific, it's a lot. But historically, physical therapists that we have that have that growth mindset do really, really well. So that's kind of like number one. We look for growth mindset. And then we look for a true passion for helping people and problem solving, because that's so much what we're doing on a daily basis, is figuring out these various issues: movement dysfunction, limited range, whatever it is, could be different every session for the same person. And if you enjoy doing that, then you're going to have a good time here.
I love it. Okay. And you had mentioned also too that about the growing trend of objective data collection through wearables, like I guess what, like rings or watches, and, or even through your phone. How do you see this evolving in physical therapy, and how are you positioning Revo to leverage this trend?
Yeah, already with what we have, on a watch, there's so much data coming in. What we have found is sometimes it's difficult. It's like a fire hose. There's so much here. What do we do with it? I'm envisioning that more of these findings, especially at the rate which AI is popping off right now, like more actionable data. what to do with the findings and drawing connections between various data sets. So our patient population is super endurance based. So we
They're
look at,
tracking.
yeah, exactly. Like I'm tracking every run, every bike ride, whatever it is. And we help patients all the time go through the Garmin data or what they're posting on Strava, power on the bike, and making insights as to how that might affect their knee pain. But in the future, I'm envisioning more platforms being more connected and those correlations being clearly obvious. And then beyond that, actionable. How is this going to affect training program, stretching, mobility, activation, those kinds of things? Like, see that happening relatively soon.
Or even just like something that they're doing that's causing the pain. I would imagine it's like
Absolutely.
maybe you could do it a different way. Like who
Yep.
knows? Yeah.
Yeah,
Okay.
absolutely. Like we'd love to make more connections between, what our patients are doing when they're not here. It's really easy when they're here. We can look at the movement quality today and we have a view of what's happening on Monday, but oftentimes we won't see folks for a couple of weeks. So what are you doing even sitting? Like I accidentally pulled a 10-hour day in front of the computer. Of course, my hip is tight. I wasn't really thinking about it, but I'm getting a little, update from my wearable, whatever it is, to kind of notify me of that. And then
Get up and
sometimes
move
it can help
around.
set expectations. Yeah, of like, well, cool, I did a huge day at the desk. Maybe I should spend a couple extra minutes mobilizing here, opening up my hip, whatever it is.
Yeah, no, that would be really cool. I mean, just like more triggers to like, hey, sitting too long. It's kind of like I've seen the AI in the car where it's like when you've been on the road for a long time, it's like, do you need a
Oh
break?
yeah. Yeah,
I love that. So if more things were showing up for us, that's like you've been sitting too long, or or whatever. If you are doing some sort of sport activity, like having some data that comes back that can help you do it a better way or to do it with less pain, right?
totally.
All right. Well, thank you for your insights, Dane. I really do appreciate this. Tell the audience how they can find you.
Yeah, absolutely. Best place would be revoptboulder.com or revoptdenver.com. We have an office here in Boulder and Denver to help people feel their best.
Thanks for tuning in to this episode of The Wellness Growth Show. If today's conversation sparked something for you, hit subscribe so you don't miss the stories, strategies, and insights from the front lines of wellness innovation. If you're a founder, operator, or health leader exploring growth into institutional markets and have a story worth telling, I'd love to hear from you. Reach out directly on LinkedIn or YouTube. And if you found this valuable, share it with a peer or post it online. You never know who needs to hear it. Until next time, stay well, keep moving, and keep building what matters.